Hi there, welcome to the archives. So I thought I would stick with the theme of HIV in heterosexual communities today. I feel like the last video I said some words that maybe not everybody knows what they mean, like PrEP and PEP. So I'm going to get into some of those definitions today. I'm looking at two resources today. We're going to go to the ACHO website. So ACHO here in Canada, Ontario, is the African and Caribbean Council on HIV/AIDS in Ontario, ACCHO. I'm also going to look at some resources from Black CAP, which is the Black Coalition for AIDS Prevention in Toronto. So I'll start with Black CAP's website. They have a heterosexual fact sheets for HIV and STI, and they also have it for the queer community as well too. I'm going to start here since the topic was looking at HIV not within the LGBT community but within the straight community. So this heterosexual fact sheet, again, it's by Black CAP. It's on the blackcap.ca website. So it says more than 75% of HIV diagnoses in Ontario's Black community are attributed to heterosexual transmission. So again, the whole reason I did that video was to let people like Sam George know that framing HIV as a gay disease is very dangerous, because over 75% of HIV diagnoses are straight people. It's not gay people, it's not lesbians, it's not trans people. This idea that like gay people have HIV and they are the ones who it spreads about, it's stigma, it's discrimination, it's homophobia, and it's also not true, right? More than, again, go look at the Black CAP website. It says more than 75% of HIV diagnoses in Ontario's Black community are attributed to heterosexual transmission. HIV incidence has been stable or increasing in Canadians exposed to HIV through heterosexual sex since 2008. According to a 2011 national HIV estimate, about 34% of HIV-positive people whose infection is attributed to a heterosexual exposure remain undiagnosed. So this is 2011, that's years ago, okay? This is why it's so important to get tested, to know your status, and to always use protection, even for heterosexual sex. But it goes on to list some risk factors. So risk factors include not using condoms, not using clean equipment, getting drunk or high lowers your ability to make clear decision, and it increases your risk of rape or unprotected sex. It says semen can live in the body for up to 2 to 3 days, providing a lot of opportunity for HIV to get into the bloodstream. Having sexually transmitted infection or yeast infection can increase your HIV risk because more white blood cells are present. Experiences of racism affect self-esteem and can lead to unhealthy coping activities. If we do not understand how we get HIV and what we are at risk, we will not take actions to lower our risks. Sharing sex toys without cleaning them or using a condom gets a person at risk of contracting HIV or sexually transmitted infections. It is quite common for one member of a family to come to Canada first, get established, and then send for the others. While apart, they may be involved in sexual relationships that could put them at risk. So what are some safer choices? So there are safer options, right? There are safer choices. So it says here, there are many ways of protecting ourselves from HIV and other sexually transmitted infections. Use latex or polyurethane condoms or insertive female condoms during sex. Insertive condoms is gender neutral, but traditionally is used for women. You should also use water-based lube whenever you use a condom. So it's important to use water-based lube when using a latex condom. Use a condom or a dental dam. Dental dam is a square sheet of latex that you place over the vagina for oral sex. If you cannot find a dental dam, you can cut the tip of the dry condom and cut along the length. Don't share injections or inhalation equipment. Use a new needle for tattooing every time. New mothers who are HIV positive should avoid breastfeeding. New mothers who have never tested for HIV should discuss testing for HIV and advice about breastfeeding with their healthcare provider. Use alcohol responsibly. Plan ahead. Keep sex toys for personal use, but if you share, use a condom or clean the toy before you use with your partner. It says keep sex toys. Oh, I just said that. Wait at least 30 minutes after brushing or flossing before oral sex. Cuts or tears in one's mouth can allow HIV to enter the blood during oral sex. So for men here, it says some cultural, religious, or social beliefs present unprotected sex as a man's prerogative, a sign of manhood, or as a good sexual health. Community intolerance of gay and bisexual men and other men who have sex with men may lead some men to avoid HIV prevention education or to engage in relationships that limit their ability to practice safer sex. For women, it says many reasons women are 5 times more likely than men to get HIV. So for example, the female genital tract, the cervix, and the uterus provide a greater surface area for absorbing the virus. Semen may remain in the genital tract and beyond for up to 3 days. There are some cultural and religious beliefs about the roles of women that can limit their ability to negotiate safer sex or expose them to sexual abuse, assault, or violence. Some women live with the threat of violence in their relationships and may not feel safe enough to say no to sex or to negotiate safer sex. There's also homelessness, which increases HIV risks, as women may feel they must trade sex for shelter or that they're at risk of rape. So cultural practices such as female genital mutilation, FGM, may increase the risk of becoming infected with HIV if a tool that's used to perform FGM is not sterilized, or if the affected area does not heal properly despite appearances, or if the scarring is ruptured through sexual intercourse or childbirth. So these are some of the ways also that heterosexuals can get it based on the last conversation. Now, in the last conversation, I brought up HIV testing, for instance. Untreated HIV can progress to AIDS. So again, there's 2 different ones. AIDS is acquired immunodeficiency syndrome. So again, HIV is a virus, right? Human immunodeficiency viruses. Viruses attack the immune system, which is why immune is in both of the words. So it attacks your immune system, meaning once you get anything, a cold, a flu, pneumonia, your immune system is what fights those infections. With HIV, it suppresses and compromises your immune system. So your immune system is not going to be as strong as it would be to fight other infections or diseases or illnesses that you come up against in general, right? And so treatment helps to prolong life and ensures that you don't get to the point of AIDS. There are existing treatments. They're called antiretroviral drugs, and they effectively manage HIV and early diagnosis. So testing early initiates, if you are HIV positive, testing early is a great thing because it means that you're able to get on the antiretroviral medications earlier and then start treatment. It's essential to prioritize HIV testing as part of our sexual health because you don't always experience symptoms. Not everybody gets symptoms, right? Usually if you're going to get symptoms, you're going to get it within the first 3 months, which is why it's important to routinely get HIV testing. When I was talking in one of the previous videos, I brought up the words PrEP, PEP. One second. So PrEP, P-R-E-P, is pre-exposure prophylaxis. So it is a medicine that people at risk of HIV take to prevent getting HIV. It says if taken consistently, it's highly effective. So PrEP is what you take before exposure to HIV. It involves taking a daily medicine to prevent HIV infections before exposure. It is particularly crucial for individuals at high risk of HIV, including those within the Black community, the Caribbean community, the African community, who are disproportionately affected by HIV virus. Including PrEP into HIV prevention strategies allows individuals to significantly reduce the risk of acquiring HIV. Okay, so you could take medication beforehand if you know that, let's say you're HIV negative, you don't have HIV, you're going to a rave or a festival, you know that you're going to be high on drugs the whole time, alcohol, like you know it's going to be a high risk event. Maybe you want to talk to your doctor and get on PrEP beforehand. Right, so you can start taking the medication. That way, at the festival, if you do have unprotected sex, if you do use a needle that hasn't been clean, if you get a tattoo from a tattoo gun, you have no clue where the tattoo gun came from. If you are doing high risk activities, it can lower your chances of getting HIV. Okay, so that's what PrEP is for, pre-exposure prophylaxis. PEP, PEP, is post-exposure prophylaxis. So pre is before, post is after. Okay, so PEP involves taking antiretroviral medication after potential exposure to HIV to prevent infections. It is critical intervention for people who may have been exposed to HIV through unprotected sex, needle sharing, or high-risk activities. You should be aware of the availability of PEP and seek immediate medical attention if they believe they have been exposed to HIV. So again, this is post-exposure. Oh man, I went my 29th birthday, for instance. I probably should have used PEP, right? Damn, I went out last night. I blacked out. I don't know what happened. I can't remember. Maybe I was roofied. Maybe I wasn't roofied. Maybe I was raped. Maybe I wasn't raped. But I just don't know what I did last night. Oh, I woke up this morning. There's a bunch of needles everywhere. I don't know if we cleaned the needles. I don't know, right? Oh man, the condom broke. I was having safe sex with somebody who's HIV positive, but then the condom broke halfway through, and now I need to go take the morning after pill. But what about the HIV? PEP, post-exposure prophylaxis. Okay, so that's what is important for a lot of folks to know. PrEP has been shown to be highly effective in preventing HIV transmission when taken as prescribed. It provides a protective barrier against HIV for those who are at high risk, and those who are serodiscordant relationships or engaging in high-risk sexual behaviors. PEP significantly reduces the risk of HIV if started within 72 hours of potential exposure. So that's an important number, 72 hours. Okay? PrEP and PEP help empower people to take control of their sexual health by providing them with options for HIV prevention. They can reduce anxiety and stress that are associated with fear of HIV, and knowing how to have access with it is important. It not only prevents HIV infections, but it can contribute to improved health outcomes. By reducing the risk of HIV transmission, they help prevent the development of HIV-related illnesses and complications, leading to overall better health. Okay, so that is a little bit about PrEP and PEP. Treatment is also used as prevention. So condoms are an important tool of prevention. They're available in Ontario. You can get them in some places for free, which is why handing out condom and lube is good public health. Additionally, there's condoms come in both internal, sometimes called female, and external, sometimes called male. Condoms are used best in combination with water-based or silicone-based lubricants during anal, vaginal, or oral sex. Okay, so water-based or silicone-based lubricants during anal, vaginal, or oral sex. This information I hope is helpful for some people. Pre-exposure prophylaxis, post-exposure. If you think that you're going to be in a high-risk situation and you might want to take HIV prevention precautions, you could do that. If you think you've already been in a high-risk situation and you want to take some steps to prevent it, you can also do that as well too, right? For heterosexual couples, we're actually 75 in Ontario. We're at least 70% of HIV diagnosis. So when people say it's a gay disease, they're not telling you the full truth. The majority of HIV diagnosis, again, is within the heterosexual communities. Okay, so that's all I wanted to share. It's just I don't want people walking away being like, Dorothy's saying down low men are the ones spreading HIV in the community. No, but that is an avenue. Again, women can pass it on to men. You can get HIV through oral sex as well too. If there's cuts or sores in your mouth, right? Anything where there's any sort of cut that allows your body's bloodstream to be exposed, and where HIV is in fluid that can get into your bloodstream, okay? Whether that's a needle with HIV blood on it getting into your bloodstream, or semen, somebody ejaculates in your mouth, their semen then gets into a cut in your mouth that you don't know about, which is why they say wait half an hour after flossing or brushing your teeth, right? You don't want to floss, create a hole or something in there, then right away you go give head, and then now he's coming in you and you have exposure, okay? Again, which is why lube is also important, because it helps minimize some of the abrasions and cuts, minimizing any sort of fluid getting into the bloodstream. Is HIV getting into my bloodstream is a question. Can it get into my bloodstream? Because it has to get into your bloodstream, okay? Semen can stay in the vaginal tract for up to 3 days. So even if you had sex with somebody 3 days later, the semen could still be there. It can still have a high risk. So just wanted to follow up on some of those things, because I don't think I was really clear about it. And education is important. So that's a little bit of HIV education. The resources come from Black Hat, Black Coalition for AIDS Prevention, as well as ACHO, the African and Caribbean Council on HIV in Ontario and AIDS in Ontario. Okay, until next time, in solidarity.